Are you sure or are you unsure? Okay, only the 90s babies probably understand that, but if you are unsure, you might be suffering from what we call shoulder impingement. Shoulder impingement is when your shoulder feels tight, pinchy, sore, and we're going to talk about that today. I'm Dr. Janae Brown, and these are my fine and dandy colleagues.
Kristen, Dr. Bay,
Dr. D or Dr. Daisuke.
Both work, right? We're going to talk to you about shoulder impingement today. It's a common term. You've probably heard about it before, and we're going to slice and dice it up for you and give you a little bit about what it is. So we see shoulder impingement a lot in our clinic, right? What would you guys say? Like, how much percentage of patients would you say we probably see in our clinic?
Like 25%.
Yeah, 25%.
I see one a day at minimum.
Yeah. And I think the reason why we call a lot of it shoulder impingement is because we're always not necessarily sure what is actually the problem in the shoulder unless we have an MRI or something for further testing, and that doesn't happen often always with patients. We're trying to figure out really what is creating the problem. So we call it impingement because the shoulder's tight, sore, stiff at the end ranges, and it's a huge chunk of what we see. You might be asking, what is shoulder impingement? Dr. Bay wrote this beautiful
I know you're
for us.
asking.
And so why is it caused? Dr. Bay is going to talk to you about that right now. She's going to give us a little bit of a heads up on where this thing comes from.
Yes, thank you, Dr. Brown.
Yes.
Well, like she said, shoulder impingement is so common in our population here at Physical Therapy San Pedro, so that's why we thought it was such an important topic to touch on. It comes on usually slowly over time. This is an injury that comes on with a lot of our overhead athletes, weekend warriors, and people that do a lot of weightlifting. The big deal is it limits our ability to enjoy our sports and just basic daily life tasks, because if you can't get all the way overhead and you're limited, that just puts huge limitations on what you can do pain-free or not. So how do we get impingement? So this results because structures in our shoulder are inflamed, irritated, compressed, overworked, and this leads to a very significant muscle imbalance. Yeah. So space in our shoulder when this happens gets really tight, and really important structures for overhead movement are compressed. Mm-hmm. The body is lacking balance in this situation, and the result is pinchy sensations all the way overhead, okay?
Yeah, for sure. Well, you might feel a little better if you know a little bit about the anatomy of the shoulder. It's a complex, complicated sort of joint, and Dr. D, being so complex and complicated, he's going to take us through that. Actually, he's not. He's actually not.
This is their first impression.
That's true. Maybe we need to, give it to him because he's so simple. We need to give him something complicated and complex to talk to us about. Yeah. Okay, that's better. Fix that one.
All right, so I'm going to go over the anatomy a little bit. So the shoulder complex itself it has three different types of joints. So the one that most people know about is the glenohumeral joint, which is actually the shoulder joint right over here. So it has the ball in the socket there. And the scapulothoracic joint is the one that people don't really think about too much, but it actually provides a lot of stability, which is where the shoulder blade or the scapula meets the rib cage and the spine itself. And the last one is the AC joint. Some people have probably had some irritation there in the past, whereas the acromioclavicular joint, that's where the collarbone or the clavicle attaches to the shoulder blade or the scapula itself. So obviously it's a very complicated and complex structure for the most part. And like Dr. Bay was saying, that space in the shoulder has a lot of stuff in there with a very limited amount of space. So they have ligaments, arteries, veins, nerves, bursas. There's a lot of stuff in between there, right? So if any of those things start to get irritated or uncomfortable or kind of angry, that space gets very limited. And as if we don't really treat it, we don't manage it, then it kind of goes into a vicious cycle and limits that space a little bit more.
Yeah, and if you can see this, like this is the space right here, right? So such a small little space for the shoulder to, have. So anything wrong in there could just really throw it off, right?
Definitely. Yeah.
There are a couple things that play a big role in, shoulder health. Two of those are posture and strength. Dr. Bay is going to take us through kind of what posture is. I'm sure you guys have heard about your posture. Your mom's been telling you to sit up tall since you were little. So we'll talk a little bit about posture and really what is involved in that, and then a little bit about why strength is so important in the shoulder to help prevent impingement.
Yeah, definitely. Just like anything else in the body, the shoulder is all about balance. So when we have good posture, we have a healthy shoulder that can function optimally. Yeah, everyone should sit up straight right now.
Someone says posture, you're like, oh, okay.
And when we have poor posture,
Oh yeah.
poor posture sets the stage for these overuse syndromes that we're discussing. So the most common postural deviation we see would be a rounding of our thoracic and lumbar spine, and that leads to forward shoulders and forward head. Now, that really important AC joint Dr. D was just talking about leads to a lot of closing down when we have poor posture. So all that room that's there when we sit up straight is now gone, and all these structures are really getting impinged, okay? So what happens when we have this poor posture is it's deactivating a lot of the muscles on our backside that provide really good stability, and then it's creating a situation where we're using the muscles in the front way too much, so we're lacking that balance of the body.
So you get like tight pecs and stretched out upper back muscles, stretched out rotator cuff, right?
Yeah.
Because you're constantly like this, and people say my pec's tight, they want to stretch their pec like crazy.
Yeah.
But one thing you can do is just work on your posture a little bit.
Yeah, definitely. So that is the number one thing we usually discuss, and later we'll talk about the ways to heal this.
Yep.
So posture is a big place to attack. The other thing that really dictates shoulder health is how strong your shoulder is. So there's two main muscle groups that are part of shoulder health. Number one is the rotator cuff. Sometimes you hear people call it the rotator cup.
The cup.
I just had to say that.
It's so funny. My rotator cup is.
We love it when we
funny.
hear stuff like that. So that's a group of 4 muscles, and the shoulder I always like to describe as a golf ball sitting on a tiny tee, so it's very unstable. The main purpose of the rotator cuff is to hug that ball super tight on the socket. It also assists in some of the elevation movements of our shoulder. Next is the muscles that are called scapular stabilizers. So this scapula wing has so many muscles that attach to it, more than 10, like 15 or 16, I believe. And all these muscles coordinate during our movements to provide a stable base for our shoulder to move off of. And then at the end range, they actually assist with the end part of our overhead movement. So again, making sure that in your weekly routines, your cross training to your sport, that you have kept these muscles strong and activated is a great way to be really considering your shoulder health.
Yeah. And when we have like good posture and good strength in our shoulder, right? Our shoulder can move smoothly and powerfully all together in unison the way it's supposed to move. So we can, throw overhead and, tumble, shoot, all the things that we do with our all the things an overhead person does, right?
One of my
overhead.
dancers has to be a flamingo right now.
Oh goodness. All right, well, what can we do? There's some simple things we can do to help with this. Kristen's going to take us through a few of these things and give you guys a little bit of tips. Yeah.
So some things that you can do are fix your posture, deload or rest the aggravated structures. You can rebuild and reload, balance the body, and then finally get help if none of those things are working, or you've already tried all of those things and you're still dealing with your issue. So, fixing your posture, you want to promote a good healing environment for your shoulder and for the tendons to give them that space. So this is, as everybody was just saying, sitting nice and tall, opening up your chest, having some muscle activity going on in your upper back, relaxing your neck. This is all going to promote a healthy environment for your shoulder.
And we're not going to do that all the time, right? Like, we're not going to, like you just saw us when we started.
Nobody is perfect.
Yeah, we sit in relaxed positions. I think the biggest thing is awareness, like that you're not always doing that, especially if, like, we don't have sitting jobs. We're up on our feet all the time. We're moving. But there are people who are sitting all the time, right? So when you're sitting all the time, you got to get up. Getting up is just a postural break, right? Take breaks, be aware. Oh, am I always slouching? That's the key with posture. Like, you're not going to be in perfect posture all the time. Your body's resilient. It can handle poor posture. Just prolonged poor posture is really a problem.
Yeah.
Yeah.
So that's what's going to create like that fatigue in your body and in your muscles. It's just too long in that bad posture.
Yeah.
So deload or rest the aggravated structures. So obviously if you keep performing the irritated movements, then it's going to make it really difficult to exchange that with good optimizing stuff. So step one is stopping the irritations. Again, going to promote a good healing environment with that. During this time, you can use a lighter weight, shorten the range. There's different things that you can change, making sure that it's pain-free movement. We're big fans of continuing to move, but just moving in the right way in this time and being sure not to further aggravate. So as you're doing this can give you a chance to work on what you want to get back to, start planning for that, and that's the rebuild and reload portion. So when it's no longer painful, your shoulder, no longer irritated, you can then finally start the controlled, gradual loading again of your weight training in your shoulders. So this is going to be through bicep work, supraspinatus work, rotator cuff, and then finally progressing back to overhead work.
And that kind of means like, I mean, when people often think like, okay, my shoulder's hurting, I have pain overhead, so I'm just not going to do anything with my upper body. Like that's the wrong view, right? The right view is the wrong view is don't do anything.
Don't avoid.
Yeah. The right view is do what feels good. Don't do that what's like going to really the thing that is exacerbating your pain, like you said, and find movements that feel good. Chest press might feel great, but doing a shoulder press overhead might not feel great. Or maybe a shoulder overhead press feels good, but with 5 or 10 pounds, not 30 or 35 pounds. Finding that space of what you can do that feels good is the key, right? As you're rebuilding, right?
Yeah. There's so many variables you can change within the process, whether if it's the weight, the position, different types of modifications and things like that. So just having that option is what's important too.
100%. Yeah.
And so balancing the body, another thing that you can do. So don't work on your shoulders and your chest and everything in the front, and neglect your upper back, which is going to kind of lock everything in. So make sure that you're checking in with your mobility, flexibility, make sure that you have that availability in the shoulder, and
yeah, I think that's it. Make sure you're prepping, doing the prep work, right? Doing the big prep work and balancing your body. And then lastly is just get help.
So if you've done all of these things and you're still feeling irritated, or if you, you just need to get help, and everything is individualized. So the most optimal way of, creating this process is going to get an individualized program. So seek professional help and
there's a lot of good tools, right? We are here to provide some education on what this is, how you can do, what you can do to help. And depending on your education level and your understanding of exercise, and that you might be able to help yourself with some simple things. But the reality is, if you keep doing the same thing that's bothering you and you're not getting better or getting help, it's only going to prolong that place. So that's what we're here for. We're experts in sort of treating injury, and we're here to help you with that. So if you continue to have problems or pain, or you've gone on YouTube and Instagram and anywhere else and you haven't found that perfect exercise, well, voila, here we are to help you put it all together and help you get fixed. So you can find us on Instagram, Facebook, Yelp, Google. If you need help, reach out. We do virtual sessions, we do in-person sessions. We are all over the place. You can follow our blogs. We're doing our best to be everywhere. So follow our blogs and stay tuned for our next blog, which we don't know what it is yet, but we will have a great topic for you guys. You guys have anything else to add?
Let us know if you have any requests.
Yep. And your requests, Tell us
That's
your
really
requests.
DM us.
Yep.
And say, I want to learn about
Blah. Yep. And then Dr. D will write it up for you.
Yep.
Happy to. I'm so excited.
So excited.
Thank you guys. Have a great day. We'll talk to you next time. Bye.
Bye.